intervention from a medical practitioner. You mentioned something about people should be checking up annually, but say the signs are already showing. Before it gets to that point where, you know, this cannot be controlled anymore, when should somebody now come and seek for the health facilities? In terms of the signs that somebody should be looking out for and say, no, this one, I should now go to, you know, daktari to ask for help.
The major sign that we get mostly are these headaches. Every time you have an receding headache, that mostly early morning, evening. That's mostly a sign of hypertension. Then, for example, for diabetes, you find that you're losing weight. In as much as you're eating, you're losing weight and you're not understanding. Unexplainable weight loss, that's the same. It can be diabetes, can be cancer or any other. Or any repetitive, any time that you go to a hospital and you're treated for the same thing over and over 3 times in a less than 6 or 1 year. We're not talking about flus, because flus are common. Then you should be able to go a step further to investigate what you're dealing with. Any symptom that is very persistent for more than 3 months, you should look at. And also a second opinion is important, because you find somebody has been going to a level 1 or a level 2 hospital with the same issues over and over. They have even become doctors of themselves, so they know, nikisikia hii, I just rush to the pharmacy and get something. So if you're dealing with a symptom for over three months and so, it's calling for a next step to find out what is the problem. Yeah.
So what are some of the most misdiagnosed chronic illnesses in the country from where you sit? I know you've handled most of them, you're in that field. What are they in details?
Hypertension and diabetes are straightforward, because I'm just taking your pressure. I know the ranges, I know when it's high. Sugar, the same. But when it comes to cancer, cancer is one of the most, cancer and autoimmune, we're talking about lupus and the rest. They are highly misdiagnosed, because you find you start at a level of GPs and also at a level of level 2 hospitals where we don't have enough. Even the lab tests that are done for them, most you find them in class E and higher in terms of labs. So you find, and that's what I said, especially for stomach cancer, utapata, somebody has been going to the hospital over and over, and they've been treated for something called gastritis for even 2-3 years. Then later to find out that they've been struggling with colon, with gastric cancer and all that. And when it comes to autoimmune issues, autoimmune are very unspecific. One day you present with a headache, tomorrow you have joint pains, tomorrow you have stomach issues. So that leads to misdiagnosis. And as I said, in terms of training, we are trained about high index of suspicion. That why am I treating this? And also history taking is also important for doctors, because I'll be able to pick that you've gone to 3 other facilities or 4 other facilities because of the same issue. So I need to think beyond what has been treated and see what might be the issue. So those are the major common, those are commonly misdiagnosed. Yeah, because they're not symptom specific. For example, for diabetes, ukikuja uniambia, I've been taking a lot of water, I've been eating a lot, I've been losing weight. That is direct. The first thing I'll check is your sugars. I can tell that. When it comes to hypertension, I've been having a very receding headache, even with medication. I'll be thinking the first thing is pressure. But for cancer, you come with very unspecific. For autoimmune, we come with very, and also there are also thyroid issues. They're also very specific. When you have hypothyroidism, I'm expecting your mood is changing, you're gaining a lot of weight and all that. When you're hyper, you've heat intolerance, you're losing weight, you're eating a lot. So some of them are very specific. Others, like I mentioned, you have to have a very high index of suspicion for you to dig deeper to know what is happening to the patient. Yeah. All right, and when we started, we were talking about how this is not a globally recognized day, and why is ours on the 10th of July? Is it that these NSD's advocacy